Topic here. So colonic ischemia, we can other places will call this ischemic colitis. We'll start off with like a question over here. So a 78-year-old female, 2-month history of abdominal pain after meals, normal colonoscopy 3 years ago. Okay, 7 kg weight loss, and a stool occult blood test over here is positive. Okay, so what is going to be our likely diagnosis? This can look like colon cancer because we're having weight loss, but the fact that like she had a normal colonoscopy and her pain is after meals is going to be really pointing towards chronic ischemia. Okay, so I've gotten this wrong myself. It's ischemic colitis. Okay, we can see colonic ischemia is going to be usually non-conclusive watershed areas. So your water sigmoid shed is your splenic flexure or your sigmoid flexure. I don't know the other names for them, but I think those are the two main watershed areas. All right, we can see right here usually a non-occlusive watershed ischemia, usually atherosclerosis, state of low blood flow, hypovolemia. We can have many symptoms over here: hematochezia, okay, abdo pain, acidosis, diarrhea, lactic acidosis, tenderness. We can see we want to do a CT scan over here. Okay, CT scan will show thickness of the bowel wall thickness, fat staining, and we can do endoscopy and friable mucosa. We can see management is going to be fluids and bowel rest, antibiotics, and the enteric coverage. Then we can see over here colonic resection if necrosis develops. We can see a 72-year-old male who has the surgical, who recently went underneath a surgical repair for aneurysm of the infrarenal aorta 2 days ago, and now develops fever, has 38.5 degrees Celsius, and develops abdo pain and bloody diarrhea and leukocytosis of 14,000. So that's everything we described above: hematochezia, abdo pain, acidosis, diarrhea, leukocytosis. This is of course going to be pointing towards ischemic colitis or colonic ischemia, whatever you want to call it. It's the same thing. So we can see that fat stranding on the CT scan. Beautiful photo here of the CT scan. We can of course do an endoscopy, which we can see friable mucosa. Just give them bowel rest, NTO. We don't necessarily need to give NG2, but give antibiotics. That's really, really important that we're going to be giving antibiotics over here. It's a really key point over here where we're going to have to give antibiotics. Okay. CT scan shows ischemic colitis, colonic thickening, and fat stranding over here. All right. So we can see macroscopic colitis over here. So this is going to be watery, non-bloody diarrhea, fecal urgency, incontinence, abdo pain, weight loss, arthralgia, NSAIDs, PPI, SSRIs. We can see duochronic biopsy. We can see lymphocyte infiltrations in lamina propria. We can see the collagenous thickening and subepithelial colon bands, lymphocytic, the heavy, high levels of interepithelial lymphocytes, and we can see antidiarrheal or budesonide. It's going to be treatment. Budesonide really helps to treat ulcer colitis. It causes it used to treat ulcer colitis where we have swelling, sores of the lining of the colon. Budesonide it's like kind of like a classic corticosteroid, so it decreases the amount of swelling. I want to come over here and recap this over here. So guys, colonic ischemia, okay, so we're just essentially getting a decrease of blood flow to the parts of the watershed area. So that can be your splenic flexure, or that can be, for instance, your sigmoid flexure. Okay, I want you guys to learn some key symptoms here. So hematochezia, abdo pain, acidosis, diarrhea, leukocytosis. Okay, we want to see we're gonna be seeing thickness. Okay, wall thickness and endoscopy friable mucosa. This, guys, is important. Okay, this is important. We have to give antibiotics. We give IV fluids, NPO, and IV antibiotics, because I believe that the vessels, they become like enlarged. There's more permeability, and we're gonna be getting getting infections. So we want to be giving antibiotics. All right. Then the next thing I want you guys to be knowing is that there is going to be a lot of how we want to go for microscopic colitis, guys. Just know that there's going to be lymphocytic infiltrate, and then we can kind of treat this with steroids as a budesonide, which is going to really kind of calming down that inflammation. So hopefully I find this video. Hopefully see you guys next time.